After the age of 50, many men start to notice changes in their sexual health. Slower or less frequent erections, decreased sensitivity, or changes in stamina. What's important to understand is that these changes are not always a sign of inevitable decline. In many cases, they are signals from your body that it needs better care, improved circulation, and hormonal balance. The penis, like any other part of the body, depends on healthy blood flow, strong nerves, and good overall health to function well. If any of these systems are compromised by lifestyle, medical conditions, or stress, performance will be affected. One of the biggest misconceptions I see in my patients is the belief that sexual health is separate from general health. In reality, the penis is often the first organ to show signs of cardiovascular problems, diabetes, or hormonal imbalances. A man might feel fine in other areas, but notice that erections aren't as strong or reliable as they once were. And this can be an early warning of underlying disease. That's why paying attention to penile health after 50 is not only about intimacy, but also about preventing more serious health problems in the future. The foundation of good penis health is blood circulation. Erections happen when blood vessels relax and allow blood to fill the erectile tissue. Anything that narrows, stiffens, or blocks those vessels, like high blood pressure, smoking, poor diet, or lack of exercise, will reduce erectile quality. This means that improving your heart health will almost always improve your erections as well. Simple daily habits like walking for 30 minutes, eating a diet rich in vegetables and omega-3 fats, and avoiding excessive alcohol can have a major effect over time. Another key factor is maintaining healthy testosterone levels. While testosterone naturally declines with age, the rate and impact vary greatly between men. Regular strength training, adequate sleep, and stress management can help preserve healthy hormone production without medication. In some cases, low testosterone is a medical issue that requires treatment, but lifestyle changes should always be the first step. I advise my patients to have their hormone levels checked if they notice a significant drop in libido, energy, or muscle mass. Finally, it's essential to talk openly with your healthcare provider about any changes in sexual function. Too many men keep silent out of embarrassment, which delays diagnosis and treatment. Remember, erectile changes are a symptom, not a flaw in your masculinity. Addressing them early gives you the best chance to restore function and confidence. Diet plays a far greater role in penis health than most men realize. The same foods that protect your heart and brain also protect your erections. The reason is simple. Erections depend entirely on healthy, flexible blood vessels and strong circulation. If your arteries are clogged or inflamed, the penis is often the first place you'll notice a problem, because the blood vessels there are smaller and more sensitive than those in the heart or brain. This is why erectile difficulties can appear years before a heart attack or stroke. In other words, the penis can act as an early warning system for overall vascular health. A balanced, nutrient-rich diet can improve blood flow, hormone production, and nerve health. I advise my patients to focus on 3 core food groups. First, colorful vegetables and fruits, especially leafy greens, berries, and citrus, which are rich in antioxidants and help keep blood vessels flexible. Second, healthy fats from sources like olive oil, avocados, nuts, and fatty fish. These support hormone production and reduce inflammation. Third, high-quality protein from lean meats, legumes, and eggs. Protein is necessary for muscle maintenance, which in turn supports overall metabolism and hormone balance. At the same time, it's important to reduce or eliminate foods that actively harm vascular and hormonal health. Processed meats, trans fats, and high-sugar snacks contribute to artery damage, weight gain, and insulin resistance, all of which can weaken erections. Excess alcohol, especially beer and spirits, can reduce testosterone levels and interfere with nerve function. Even moderate drinking, if daily, can have a cumulative effect over time. The goal is not perfection, but consistency. Small, sustainable changes make a much bigger difference than extreme diets you can't stick with. Hydration is another overlooked factor. Dehydration thickens the blood, making circulation less efficient and potentially lowering blood volume available during arousal. Drinking enough water throughout the day, not just when you're thirsty, helps maintain optimal blood flow. I often suggest my patients aim for around 2 liters per day, adjusting for activity and climate. Herbal teas, especially those with ginger or ginseng, may also have mild circulation-boosting benefits, though they should be used alongside, not instead of, proper hydration. Exercise is the second major lifestyle pillar. Cardiovascular activities like brisk walking, swimming, or cycling improve the efficiency of your heart and blood vessels. Strength training helps maintain testosterone levels and overall energy. Importantly, targeted pelvic floor exercises, sometimes known as Kegels for men, can strengthen the muscles that control erections and ejaculation. These exercises are simple, discreet, and can be done almost anywhere. Just like any muscle, the pelvic floor responds to regular training, and the benefits can be noticeable in as little as a few weeks. Finally, it's essential to see the bigger picture. Improving penis health is not just about getting stronger erections. It's about building a healthier body overall. Men who adopt better diets, regular exercise, and hydration routines often report improvements in mood, sleep, and mental clarity as well. This positive cycle reinforces itself. Better health leads to better confidence, and better confidence leads to better intimacy. Sleep is one of the most underestimated factors in sexual health, especially for men over 50. During deep sleep, the body produces the majority of its testosterone, repairs damaged tissues, and restores nerve function. Men who consistently sleep less than 7 hours per night often experience lower testosterone levels, slower recovery, and reduced sensitivity in the penis. This is not simply about feeling tired. It is a biological chain reaction. Poor sleep disrupts the release of luteinizing hormone, LH, which signals the testes to produce testosterone. Without enough LH stimulation, testosterone drops, and with it, erection quality and libido. Many men also forget that nighttime erections, which occur several times during sleep, are a natural way for the body to maintain penile tissue health. These nocturnal erections bring oxygen-rich blood to the erectile tissue, keeping it flexible and preventing scarring or stiffness inside the penis. Chronic sleep deprivation or untreated sleep disorders like sleep apnea can reduce the frequency of these erections, leading to gradual tissue changes that make erections harder to achieve and maintain. That's why I often recommend my patients with ongoing issues to undergo a sleep study. Sometimes the fix is not a pill, but better breathing and deeper rest. Stress is another silent enemy of penis health. When you are under constant stress, your body produces high levels of cortisol, a hormone that directly suppresses testosterone production and constricts blood vessels. This combination, less testosterone and narrower arteries, is a perfect recipe for weaker erections. Stress also keeps your nervous system in a fight-or-flight mode, which is the opposite of the rest and digest state needed for sexual arousal. This is why I teach stress reduction techniques as part of treatment. Controlled breathing, meditation, light stretching, or even short daily walks can make a measurable difference over time. Hormonal balance is not just about testosterone. Other hormones like estrogen, prolactin, and thyroid hormones also influence sexual function. Men naturally produce small amounts of estrogen, but excess body fat can increase estrogen production and disrupt the testosterone to estrogen ratio, further lowering libido and performance. Elevated prolactin, often due to certain medications or pituitary issues, can also dampen sexual desire and function. Thyroid imbalances, whether overactive or underactive, can lead to fatigue, depression, and reduced sexual function. This is why blood work should not only check testosterone, but also these other key hormones. Lifestyle changes can significantly improve hormonal health. Regular resistance training stimulates testosterone release, while maintaining a healthy body fat percentage helps keep estrogen in check. Adequate protein intake supports hormone production, and certain micronutrients like zinc, vitamin D, and magnesium are critical for optimal testosterone synthesis. Sunlight exposure, even just 15–20 minutes a day, can naturally boost vitamin D, which in turn supports hormone balance and immune function. The mind-body connection plays a larger role than most men expect. Confidence, emotional intimacy, and reduced performance anxiety all contribute to better erections. Men who enter intimate situations feeling relaxed and confident experience a more effective release of nitric oxide, the chemical signal that tells penile blood vessels to expand. This means that psychological well-being is not just mental, but directly affects the physical ability to achieve and maintain an erection. When we talk about penis health after 50, we cannot ignore the major medical conditions that often appear or worsen with age. These conditions don't just affect your heart, brain, or joints. They can directly damage the vascular and nerve systems required for erections. One of the most common is type 2 diabetes. Chronically elevated blood sugar damages the lining of blood vessels and the delicate nerves that carry arousal signals to the penis. This condition, called diabetic neuropathy, can make erections weaker, slower, or less sensitive. High blood sugar also makes the blood thicker and stickier, reducing circulation. The good news is that controlling blood sugar through diet, exercise, and medication when needed can slow, stop, or even partially reverse these effects. High blood pressure or hypertension is another silent threat. Over time, elevated pressure damages the inner walls of blood vessels, making them less elastic and more prone to narrowing. The arteries in the penis are especially vulnerable because they are smaller in diameter than coronary arteries. This means that even a mild degree of narrowing can have a big impact on erection quality. For men over 50, regular blood pressure checks are essential. If hypertension is found, early treatment, which may include lifestyle changes, medication, or both, can prevent years of vascular damage. Obesity plays a more complex role in penile health. Excess fat tissue, particularly around the abdomen, is metabolically active and produces estrogen, which disrupts hormonal balance in men. It also increases inflammation throughout the body, damages blood vessels, and contributes to insulin resistance. Even a moderate weight loss of 5 to 10% of body weight can improve testosterone levels, reduce inflammation, and significantly enhance erection quality. I often remind my patients that weight loss should be approached gradually, with sustainable changes to diet and activity. Crash diets can do more harm than good, especially in older adults. We must also address the impact of certain medications. Many common prescriptions for blood pressure, depression, anxiety, and even heartburn can interfere with sexual function. Beta blockers, some diuretics, and selective serotonin reuptake inhibitors, SSRIs, are known to cause erectile difficulties in some men. This doesn't mean you should stop these medications. In many cases, they are essential for your health. But it does mean that you should discuss side effects with your doctor. Sometimes, alternative medications or adjusted dosages can resolve the problem without compromising your treatment. Nerve health is equally critical. Conditions like multiple sclerosis, Parkinson's disease, or spinal cord injuries can directly disrupt the nerve pathways involved in arousal. Even long-term uncontrolled diabetes or vitamin B12 deficiency can cause nerve damage that affects erections. Protecting nerve health means managing chronic conditions carefully, getting adequate vitamin intake, especially B vitamins, and avoiding toxins like excessive alcohol, which can damage nerves over time. Finally, regular medical checkups are not just a formality. Many men avoid seeing their doctors unless something is seriously wrong, but by then the damage is harder to reverse. Annual physicals should include cardiovascular screening, blood work for hormones and blood sugar, and a discussion of any changes in sexual function. Bringing up these topics might feel uncomfortable, but remember, your doctor has heard it all before, and early intervention is always more effective. When it comes to maintaining penis health after 50, daily physical habits are just as important as medical treatment, and in many cases, they can be even more effective over time. The first and most fundamental habit is regular cardiovascular exercise. Walking, cycling, swimming, or even low-impact aerobics can dramatically improve circulation, which is the single most important factor for achieving and maintaining erections. Aim for at least 150 minutes of moderate cardio per week. For men unused to exercise, starting with 10-15 minutes a day and gradually increasing duration is both safer and more sustainable. Remember, the goal is not extreme fitness. It's consistent movement that keeps your blood vessels flexible and your heart strong. Strength training is equally valuable, especially for maintaining testosterone levels. Compound exercises like squats, deadlifts, push-ups, and rows work large muscle groups, stimulate hormone production, and improve insulin sensitivity, all of which directly benefit sexual health. You don't need heavy weights to see results. Even resistance bands or bodyweight exercises can make a significant difference when performed regularly. Ideally, incorporate strength training 2 to 3 times a week, giving your muscles at least 48 hours to recover between sessions. One of the most overlooked tools for penis health is targeted pelvic floor training. The pelvic floor muscles, particularly the bulbocavernosus and ischiocavernosus, play a crucial role in trapping blood in the penis during erection and controlling ejaculation. Weakness in these muscles can lead to softer erections, premature ejaculation, or difficulty maintaining rigidity. To strengthen them, try this. While urinating, briefly stop the flow of urine. The muscles you use are your pelvic floor muscles. Practice contracting and relaxing these muscles for sets of 10-15 repetitions, holding each contraction for 5 seconds. Do this 2 to 3 times a day. Within weeks, many men notice firmer erections and better control. Flexibility and mobility exercises also help because tight hip, pelvic, or lower back muscles can restrict blood flow and nerve function to the genital area. Simple yoga poses such as the butterfly stretch, cat-cow, or pelvic tilts can improve circulation and reduce tension in these regions. For men with sedentary jobs or habits, stretching every hour is especially important to prevent compression of the blood vessels and nerves leading to the penis. Nutrition and supplementation can complement these physical habits. While no supplement can replace a healthy diet, certain nutrients can support erectile function. L-arginine and citrulline, for example, are amino acids that help the body produce nitric oxide, a chemical that relaxes blood vessels and improves blood flow. Omega-3 fatty acids, found in fish oil, reduce inflammation and support cardiovascular health. Zinc and vitamin D play important roles in testosterone production, while magnesium supports nerve and muscle function. Before starting any supplement, it's wise to have your nutrient levels tested and discuss them with your doctor to avoid unnecessary or excessive intake. Lastly, lifestyle balance matters. Chronic stress, poor sleep, and excessive alcohol can undo the benefits of exercise and nutrition. Building a daily routine that includes physical activity, nutrient-rich meals, adequate hydration, and relaxation techniques like meditation or deep breathing creates a foundation for lifelong sexual health. It's not about making radical changes overnight. It's about creating a lifestyle where your body has every possible advantage to maintain strong erections, healthy hormone levels, and a confident sense of sexual well-being well into older age. The most important truth I share with my patients is that penis health after 50 is not a quick fix. It's a lifelong project. Erections and sexual performance are sensitive indicators of your body's overall condition, and they respond to gradual, consistent care far more than to sudden, temporary efforts. This means that the changes we've discussed, improving circulation, strengthening muscles, optimizing hormones, and reducing stress, must become permanent parts of your lifestyle, not short-term experiments. Long-term success starts with creating a sustainable routine. Many men overestimate their ability to stick to drastic changes and underestimate the power of small, repeatable habits. Instead of committing to an unrealistic gym schedule, start with walking after dinner every night. Instead of eliminating every unhealthy food, commit to adding an extra serving of vegetables to each meal. The compounding effect of these changes over months and years is far more powerful than any single treatment or supplement. Another crucial point is adaptation. As you age, your body changes, and so will your needs. Illnesses, injuries, or surgeries may require you to adjust your approach, but that doesn't mean giving up on sexual health. For example, men with arthritis might replace high-impact exercises with swimming or resistance bands. Men with cardiovascular conditions may need to start with gentler activity and progress slowly under medical supervision. The key is to work with your body, not against it, while keeping the main principles, movement, nutrition, hormone balance, and stress control, in place. Medical monitoring should be part of your routine, not a reaction to problems. I recommend annual checkups that include a cardiovascular risk assessment, fasting blood glucose or HbA1c to check for diabetes, lipid profile, blood pressure, and a hormone panel that includes testosterone, estrogen, and thyroid hormones. For men with ongoing symptoms, checking levels of vitamin D, zinc, and B12 can also be useful. These assessments not only track your current status, but also allow you to spot changes early when they are most reversible. Don't underestimate the role of mental and emotional health in sustaining sexual performance. Relationships evolve, and sexual satisfaction is not only about physical ability, but also about communication, trust, and shared experiences. Men who stay mentally engaged, socially connected, and emotionally fulfilled are more likely to maintain healthy sexual function well into later life. This might mean having honest conversations with your partner, exploring new ways of intimacy, or even seeking professional counseling if anxiety or depression are interfering with your sexual life. Finally, embrace the fact that sexual health is part of overall health. It's not an isolated aspect of life. When you eat well, stay active, get enough rest, and manage your stress, your penis benefits along with your heart, brain, and muscles. Treat every healthy choice you make as an investment not only in years of life, but in the quality of those years. The goal is not just to keep erections, but to maintain the vitality, confidence, and emotional connection that make intimacy meaningful. If there's one thing I want every man over 50 to remember, it's this: Your sexual health is not gone unless you give up on it. Many of the declines associated with age are preventable or reversible with the right habits and medical care. Start small, stay consistent, and treat your penis as the early warning system and the reward of a healthy body.